Hello and welcome to the Glow Up Fabulous Conversations with Innovative Minds from Health 2024. Today, I'm here with Sandra Johnson from Clinico. It's so great to see you today.
Yes, thank you so much for having me.
So, can you start us off today by introducing yourself and what you do in healthcare innovation?
My name is Sandra Johnson. I'm the Senior Vice President of Client Services at CliniComp. We are an EHR provider. We've actually been in this space for 40 years, but we've been working on the government side. We've continued to evolve and innovate our product to meet the demands of the market. We're very excited because we're now finally coming to market with a full EHR solution suite. We've been known for our inpatient solution and our medical device integration. We're just responding with continuous innovation to make sure that we're meeting the needs of the industry.
Amazing. I'm not super familiar with the electronic health record space. Is there a specific area within the different populations of providers and clinics that you specifically serve with Clinico services?
We have been in the inpatient setting for the majority of our tenure.
Mhm.
So we work with a lot of healthcare systems, and over the years, we've evolved to offer beyond inpatient, the ambulatory setting, ancillary services, and supporting the revenue cycle management space as well. Our goal is to bring a fully integrated solution to market so that you have a holistic view of the patient and
Mhm.
all of their experiences. So that you can see that longitudinal record, no matter where they received care, if it was another hospital, inpatient, outpatient, all the information that's necessary to make
Mhm.
informed decisions on how to move forward and treat that patient would be available to you.
Interesting. So, really thinking of electronic health records, not just a place for doctors to store their data about your visits, but also using the data in the records to be a contributor and a player in that care cycle for the patients.
Yeah, absolutely. I think a lot of people, when there was a transition from paper charting to electronic charting, it was really an administrative tool and used for
Mhm.
purely documentation. And that's really not servicing the patient population or the clinician. So the idea is to have technology that enables you to focus on the patient care. And so we've incorporated real-time reports, real-time alerts, early warning dashboards so that there's clinical surveillance that can provide data points to you to make informed clinical decisions at the appropriate time. So making sure to serve the information in meaningful ways at the point of time that a decision is needed. And so really bringing all that data together, automating workflows so that you can focus on patient care, but have all the information necessary. That's really the goal. Make it
Mhm.
as easy, intuitive to use and really actually add value to your day.
And you said you're working on this, or you've just launched this new platform, comprehensive platform. Where are you looking to innovate by launching the platform? How does that pull everything together?
Yeah. We are excited to get back to the commercial marketplace. When
Mhm.
we started 40 years ago, we actually entered into the commercial marketplace with our perinatal solution. And then we evolved to our inpatient solution on the federal space. And so we're returning to the commercial sector with a full EHR solution suite that really can help accelerate the way EHRs are utilized within a healthcare system. So that's where we're hoping to return, but we also see a lot of opportunity in that community hospital, rural, critical access space where there's a need for superior technology at a more affordable price point. There are cost constraints from making a change. And so we're trying to mitigate that as a challenge and really bring valuable technology to a community that is underserved.
Yeah. I I come from a town of like 15, 18,000 that was a county seat. So it was the largest city for like an hour and a half in any direction. And still my family that's there often travel another hour or two to get healthcare because the level of service, the level of communication, any kind of the automation, the ability to connect digitally just like was not at the same level. So I could see how having a low cost system where I started to get really excited was like, if the EHR is contributing insights into the care cycle and you're bringing this kind of tool into a system that might be a little bit constrained, may not have a lot of resources for business or data insights, like how could a tool like this start to empower and bring AI, bring this kind of automation into a very small system that maybe not have the resources otherwise. It
Yes,
okay.
absolutely. I mean, obviously, the latest trend is AI. And with our system having intrinsic AI as part of the product, just ensures that you're able to automate those workflows, really streamlining process so that all the data that's available to you can be served up for you to make that decision and take the further action, but just contributing to expeditious diagnosis, treatment plans, whatever that might be by automating the workflows through intrinsic AI is very important.
Mhm.
And when you were talking about the community that you grow up in, I think one of the biggest challenges is access to care. And so making sure that there is a telehealth component so
Mhm.
that those that can't get to a brick and mortar facility can still receive care if they have chronic conditions, have remote patient monitoring, just making sure that you have all the tools and technology to be able to support the community and whatever methodology is going to be best for them. And so there might be limitations to access or service, but trying to remove those barriers so that there is better access to
Mhm.
care.
This idea of using technology to reduce barriers to access to care, it's something that I feel like I've been hearing a lot at health, and it feels a little different of a mindset than what I'm kind of used to experiencing, where like it feels like insurance companies and doctors' offices really used to insist that like all care has to happen with a one-on-one with a doctor. And it seems like what I'm hearing here is everybody in the ecosystem is ready to use technology to fill some of those gaps, to reduce some of those timelines, to give people more time with the patients. What do you see as driving? How do you see that push to remote services and tech enabled services? How has that changed how you approach your work?
Yeah, I would say that one of the greatest things that came out of the pandemic was that acceleration to virtual care.
Mhm.
There were so many policies or limitations that really made that a barrier to receive telehealth services. And so the acceleration and adoption of technology for virtual care was exacerbated by the pandemic. And so we've really been able to leverage that and find ways to continue to innovate in that space and bring more options
Mhm.
to the communities. And so, we work closely with the Veterans Administration, and I feel like they're leading the way in telehealth. They are making sure the large veteran population are in rural and remote areas. And
So
so,
much, yeah.
yeah, and there's so many barriers, transportation to a facility, distance to the facility. And so, really finding ways to service the veterans in their homes. A lot of veterans have chronic care conditions. And so, really being able to provide that type of service, it cuts down on the ED visits, inpatient admissions, and really, again, brings access to the care that they need in a way that they can receive it.
Ah, amazing. I'm having to reframe how I understand health records in my healthcare, but it's cool to hear that it's evolving and really meeting the opportunity and being that connector of where all the data sources are coming from. So, Sandra, I would love to back up just a little bit. As somebody who is working in this healthcare technology, healthcare innovation, healthcare data, it seems like you would both need lots of diverse skills. I'm very curious. What was your journey to this role, and where did you pick up all of those superpowers?
A jack of all trades is what makes you a well-rounded individual to bring a new perspective. And so when I, graduated from college, I lived in the Washington, D.C. area.
Mhm.
I grew up, my father was in the military and the Navy. And so I did a lot of government consulting work and had exposure to, program management, system implementations. And I got a broad range of exposure that led me to identify where my strengths and skills were, where my interests and passion were. And that over time led me to the healthcare space. And so I had the great opportunity to work with the Department of Defense and supporting all of the various systems that they implement. And that brought me then to CliniComp as we were implementing our inpatient solution there. So I've had a great experience supporting our Department of Defense customers. And now I'm looking forward to bringing the solution that's been so well utilized in the inpatient setting to the commercial market for all to take the benefit.
Are there learnings that you have working with veterans and working in government systems that give you unique perspective on how you approach your work in similarly large and complex healthcare scenarios?
Yes. I mean, that's a great description because in the federal government, it is one of the largest healthcare systems there are. And there are so many unique services and offerings that are beyond the traditional commercial setting. So, all of those opportunities, though, translate well to the healthcare industry at large. And so, I've been exposed to so many wonderful individuals and people and learned so much. And I've seen so much over my career. And I'm just excited to be able to bring the voice of the customer. I think that's the number one thing that we need to focus on. You mentioned earlier, individuals want to be a part of their patient journey. So it's not just the clinicians and the patients, it's the family members, and everyone wants to be a part of that process and be informed and involved in what the care plan is going to be. So really leveraging technology to expose more of that information and bring the consumers into the process and the healthcare planning is very important. And so what I'm very proud of in the work that I've done at CliniComp is partnering with our customers to hear what their challenges are and then bringing that back to further evolve and innovate the product to meet.
One of my favorite questions. Is there an example of learnings that you had from your customers that changed how you approached your product or how even the company maybe?
Yeah, absolutely. I mean, we put clinicians front and center when we're developing our product. They're embedded in our organization. Same goes to listening to customer feedback. And so, working with the VA, we have a robust medical device integration solution so that we can interface with all the various bedside devices and bring that data and waveforms into the product.
That's not commonplace that all the tools that are used in an operating room actually can talk to health records.
Unfortunately not. There's a lot of disparate systems, devices, and all that data is not shared. And so that is the key is
Okay.
bringing all that information
Yeah.
to really have a holistic view.
I don't know that many patients necessarily know that. Yeah, that's what a challenge, right?
Yeah. But bringing that data in, that just not only is it a time saving for the clinicians, they're not having to look at this device and then replicate the information in the EHR. It's just providing that integration. It's time savings per patient, per shift. And then evolving that to also offer e-caliber tools within the product. So we just put the voice of the customer first, and all ideas are good ideas. And if they're going to benefit our customer base at large, we're committed to making sure we continue to evolve the product to do that.
Amazing. Do you have goals for like how quickly you can iterate on insights when you learn something like that? Is there like a product timeline goal for that sort of iteration?
I would say tomorrow. We always want to do it as fast as possible. And so, one of our founding principles essentially is continuous innovation. So we're driven by bringing meaningful results to our customer base. So as soon as we have a challenge and solution we want to solve, we're immediately taking action to make sure that that gets brought to fruition in the product. So we are very agile in the way that we develop the product.
Do you include your customers in those sort of product iterations and developments?
Absolutely. Whenever we can, we do, because we want to make sure that the development is actually meeting the need, and who better to judge that than those using the product. So a lot of the requirements will come from there. Sometimes we'll do focus groups to get additional feedback. We provide continuous site optimization visits to make sure we're hearing what's working, what's not, tips and tricks. How can we continue to optimize the system to meet your needs? So we're constantly bringing our clinicians into the fold and being part of that process.
I love this. It was a bit of a trick question because I come from a spatial computing, XR, AI background. And in the tech startup space where I have a lot of conversations, there's a lot of technology for technology's sake. And I see that where a lot of the gap in value, the gap in go-to-market success typically is around like, are you actually showing this to customers? Are you actually testing it? Are you actually doing this last mile research to prove that it's valuable rather than just like a really cool slide deck?
Yeah.
And so asking, health technology professionals, how do you learn from like we do tests, we have to do clinical tests, we do adoption tests, we do in hospital tech trials with, So thank you. And like message to all of you tech innovators out there, like do the research.
Yes,
Um,
there is a full software development life cycle for a reason.
One of the questions that I've been loving to ask people has been, do you have any big takeaways or themes that you're noticing from the conference or your conversations here at the event?
Because I'm supporting the EHR sector, we are participating in the Market Connect program. And so we talk with a lot of healthcare systems about what their needs and challenges are. And I think what's really refreshing and exciting for us to hear is that there is a need for disruption in the marketplace to have more alternatives and options and really make sure that our systems and technology are solving the challenges of today and not just being the status quo. So, in refreshing and re-engaging to hear people actually be open to change. And so that, just having those conversations and dialogues and hear what people's current challenges and struggles are really, resonate with us and give us more opportunities of where we can innovate, what problems we can solve and what direction to go.
So that leads me to my next health themed question. And you talked about what next problems to solve. So the theme for the show this year is Be Bold. And if you had the opportunity to head over to the main stage and grab the mic after Dr. Jill Biden or whoever else is up there right now, and encourage this audience, this community to be bold in some way, how would you encourage the health community?
I think I would just really challenge everyone to take big risks. Without big risks, you're not going to get big rewards. And I think it's really easy to go along with the way you've been doing something or, just kind of the status quo and really thinking outside the box. With AI being the latest trend, there's so many ways to utilize that and incorporate that into healthcare systems and really just challenging what is going to add value. How can we maximize our return on investment? Where can we take this? So really just take big risks. You'll see big rewards and have faith in the process.
Amazing. Take big risks. That is a challenging statement to bring to a healthcare. Some of my conversations on the podcast this week have been, how it's hard to take risks
Yeah.
or that innovating in a risk adverse environment is a challenge, right? Even company to company, there can be challenges in, what feels. Sandra, this is sort of a pop quiz. So I hope you'll join me on a little bit of a sidebar, but the Glow Up is part of the Like a Girl Media Network. And I'm curious if you have any advice for other women who might be interested in working in innovation or healthcare innovation, or just people who are interested in healthcare product and innovation, how they can get started or think about path, how they can be bold in the future of healthcare innovation.
Yeah. Well, I think it's always a step outside your comfort zone. So even if you're not in healthcare and that's of interest, really just finding mentors or colleagues, friends of friends that you can ask questions, being inquisitive, learning from others, seeking out advice, seeking out mentorship is going to help catapult your success. And so really not being afraid to advocate for yourself, ask questions, be curious, and really seek out mentors because that's what's made me successful in my career is I've looked up to several people that I've worked with in various industries. It doesn't matter if they're in healthcare or not. Everyone has some skills and key lessons that you can learn and take with you and apply as you move forward in any industry. And so I really just challenge people to take control of their own destiny and, look for those that they want to emulate.
Be bold, find people that you want to learn from and connect with them, ask them to be invented. I have to tell you, like, I've seen it in action here. Two people will walk up to each other and one will be like, "Oh, you're a nurse too?" And it's off, right? Like,
Yes.
being here, being visible, being curious is enough to create great connections and great audience. This has been such a fantastic conversation, Sandra. I have loved so much getting to learn about these new ways that technology can help make decisions, help doctors' days be faster and more organized, and how players in every part of the healthcare chain of care can be contributing to the insights and user experiences, patient experiences. Such a fantastic conversation. Thank you so much for joining me today.
Yeah. Thanks for having me.